Good afternoon. Thank you, everyone, for taking the time to join us today. This afternoon, from the Legislative Building in Regina, we have Saskatchewan's Chief Medical Health Officer, Dr. Shahab, as well as SHA CEO, Scott Livingston. And on the phone, we have Derek Miller, SHA Emergency Operations Center Commander. We'll start with opening remarks from Dr. Shahab and Mr. Livingstone, and then we'll move to questions. Dr. Shahab?
Thank you. So, good afternoon, everyone. So, I'll maybe start first of all, as always, expressing my condolences to the family and friends of Saskatchewan residents who have passed away. And since last Tuesday, 4 further residents have passed away, 3 yesterday and 1 reported today. And again, while our deaths and along with our hospitalizations have been trending down, thankfully, we just, the fact that we are still losing individuals to COVID and are still seeing hospitalizations emphasizes that we really need to stay the course, especially because we have also seen over the last week that we have found increased isolations of variants of concern, not just linked to international travel, but showing some initial start of community transmission of variants of concern as well. So all of this just compels us to really keep practicing all the public health measures we have been practicing very successfully, and keep doing that to keep our cases trending down. And of course, there's lots of opportunities now to get tested, but testing is one layer along with all the other measures that we practice, physical distancing, mask use, staying home when we're sick. But testing is an important layer because by testing we know what our status is, and if we are COVID positive, we can, for the most part, safely isolate at home for 10 days. For many people, it's a milder illness. We can also immediately notify our close contacts so they can isolate for 14 days. And that really is essential to break chains of transmission. What we've really seen is that recently is that, people have delayed testing. They've had symptoms for many days. In some cases, unfortunately, they've continued to go to work, and that has resulted in outbreaks in workplaces. And I think we really need to make very sure that we, monitor our symptoms every day. We monitor our children's symptoms every day. At the first sign of any concern, stay home, get tested. You can get tested right away at the onset of symptoms now, but if your test is negative and your symptoms are continuing, do get tested again, just to make sure that you are COVID negative. And I think testing will be an important layer in an ongoing fashion, along with easier access to many other modalities of testing that we'll hear about, that will really increase our ability to continue to show a downward trend. If you're traveling interprovincially, again, it's a good idea to monitor yourself once you come back and get tested on arriving back to Saskatchewan and at day 7. And of course, continue to assess your risk. What kind of risk are you exposed to at your work? Do you have children in school? Are you a close contact of someone who's more vulnerable? And I think this is again the time, while all of us kind of want to get together again, and we can get together safely outdoors for the time being, but we have to take special care around those who are more vulnerable, 60 and older, 50 and older with underlying risk factors. The older age groups are so close to getting vaccinated over the next few weeks and months, and I think we should do everything we can to shield people who are older, who are more vulnerable, so that they can successfully get vaccinated. And as we've seen, even from our initial data, a vaccination is an important step to reduce your chance of getting seriously ill, and hopefully over the next few weeks and months that will show in declining hospitalizations and declining deaths. Thank you.
Thanks, Dr. Shahab. So I would also like to pass on our condolences to the families who've lost loved ones in the last few days. It is also a sad reminder, despite the hope created by the vaccine, that it's still critical that we continue to take the necessary precautions against the spread of the virus. This high number of deaths of COVID in the last couple of months is having a large emotional toll, not just on families and friends of those loved ones who passed away, but on healthcare workers who work and do everything they can to ensure they save lives and protect those individuals across the province from COVID. Today I'm going to address three main topics in my opening remarks: vaccine distribution, testing, and variants of concern. First, with respect to vaccine distribution, we are working at strengthening our processes and communications around our immunization strategy. We're committed to a vaccine distribution process that is fast, fair, transparent, and safe. As you've seen, we are making great strides in getting our infrastructure up quickly to manage higher volumes of vaccine as they arrive. Last week, we were able to deliver 4,000 vaccines in a single day, and we know we're capable of doing much more than this. As an example, out of those 4,000 vaccines that were delivered on the weekend, on that Saturday, 3,300 were in rural and northern Saskatchewan, and we're not using our large vaccinations capabilities in either Regina and Saskatoon. We've received a high volume of questions in the last few days and weeks around the process for notifying those individuals over 70 years old, and I'd like to address this issue directly. We are in phase 1 of vaccine rollout. This means when vaccines are distributed to a community, long-term care and personal care home residents and certain prioritized healthcare workers are receiving COVID-19 vaccine as a priority group. After those populations are vaccinated, local public health officers or officials will be establishing clinics for residents 70 plus. To fill these clinics, we are contacting eligible recipients wherever possible by phone based on their age and location until all available appointments are filled. Priority sequence is maintained, contacting the oldest residents first and then descending by years. Please note that the appointment availability is driven by vaccine availability. At this time, there isn't a clinic in the province that's able to receive enough vaccine to immunize all residents eligible in phase 1. Once these appointments are filled, the clinic must be suspended until more vaccine is made available to the province. The lack of vaccine availability has created challenges, both for residents who become aware of clinics but have not yet been contacted by public health to book an appointment, but also for our teams that have had to pivot each and every week since the vaccination program has started because of the lack of consistent supply of vaccinations to the province. We are currently looking at many ways to improve the booking and communication process, not just for phase 1, but also phase 2 in the province, and you'll see some important changes in the upcoming, very soon, including, as you know, today, we're primarily using a way of us contacting residents, but we'll be moving to a system where residents are able to contact us and choose their vaccination site and their vaccination time, which will greatly improve the process, but it will still be hampered by a lack of vaccine supply until vaccines start flowing in a consistent manner. This is why, in my next comments, I'm going to talk a lot about the importance of testing and why it's such a crucial part to our strategy in maintaining our offensive work around containing, mitigating, and delaying the virus spread across the province. To that end, we are announcing today, as you've heard, that we've taken steps to get more rapid testing clinics or kits into more places across this province. To support the expansion of point-of-care testing, the government has amended the medical lab licensing regulations to exempt potential additional sites from requiring a lab license to deliver these safe and simple tests. This means we can take steps to get more than 700,000 rapid test kits available from the federal allocation to a wide variety of additional sites in the province, which would be in addition to the long-term care homes, which already have access across the province to point-of-care testing, and our acute care sites. These are simple tests, are readily available, and some of the new sites that will be included in this expansion include personal care homes, group homes, detox facilities, emergency shelters, and schools. Rapid tests will also be made available to ambulance, police, and fire services, as well as pharmacy and dental offices for staff that work within those areas to ensure that we're screening essential workers in those areas. We know that many of the new sites will not have the capacity to deliver these tests on their own, so with that in mind, the Ministry of Health is working with SAS Builds and Procurement to develop a request for qualifications tender for third-party providers to deliver testing in locations that need assistance. This is going to take a little bit of time, but we are committed to using these tests widely across many venues in the province as soon as possible. There are still some operational and logistic details to sort out, but it is hoped that the delivery and support for the expanded venues can happen over the next few weeks. Finally, I'd like to end on a note of caution. While there have been lower case numbers at times in recent weeks, the existence of variants of concern is very concerning. This may fuel exponential growth of cases, as Dr. Shahab has said, so in the days ahead, we're going to need to maintain our vigilance and monitor this trend very closely. We're not out of the woods yet, and we can't take our foot out of off the gas with respect to adhering to public health orders and ensuring that we keep everyone safe as we move through the vaccination program. Thank you.
Thank you both. We'll now take questions. We'll start in the room. Lynn?
Sure. With these rapid point-of-care tests, when can places actually expect to see those rolled out if a lot of them can't administer it themselves?
So as I said, we're working, first of all, the point-of-care testing are already rolled out in long-term care and acute care. The ministry is working with private care homes and so those other group homes and others to look at rolling out the antigen test as we speak. With respect to fire, police, and the other pharmacies and dental offices, that's what that third-party RFP is out. So I can't give you an exact date because, like I said, we hope it's in the weeks to come, the next few weeks, but it'll depend upon how successful we are as attracting somebody as a third party to do this work. So included in that is schools. So for example, in schools, where often schools have public health nursing people within their facilities, the program could probably move forward a little quicker because they've already got staff that are able to do that testing in schools. So it won't be the same for everybody accessing those tests, but we'll move forward as quickly as we can.
Follow-up question?
Yeah, this is probably for Dr. Shahab. With the variants of concern now, those two in Regina that aren't linked to travel, are you concerned about community transmission of those happening now, and what does that mean for the province?
So, in many other provinces and many countries of the world, that's exactly what's happened. Initially, you identify variants of concern linked to travel, and then very quickly over the next few weeks, you start identifying more community transmission. We're just starting to see that, and I think that's why it's really critical that we not only keep our overall case numbers low, we practice all our public health measures consistently to delay as much as we can the variants of concern becoming the predominant strain, because the challenge with that is that some of the variants like the B117 first identified in the UK is more transmissible, so you need even more stricter measures if that becomes the dominant strain. Some of the variants of concern may have other challenges in terms of vaccine efficacy. So I think we need to do everything we can to keep our overall case numbers low, minimize importation of variants of concern, and from that perspective, obviously, international travel is not recommended. When you come back, you have to get tested, and you're only allowed to proceed further if you test negative, and you have to stay at a site for up to 3 days. But even for interprovincial travel, we really, my recommendation is minimize non-essential travel. And testing is widely available, even as point-of-care testing is deployed. Routine testing is widely available. If you do have to travel interprovincially, comply with all the public health measures. When you come back, consider getting tested on coming back, and in a week or so, it'll make sure that it'll reassure you, it'll reassure people in your household, in your workplace. I think we need to use testing more, even more now, because of the variants of concern.
We'll take a question on the phone line.
We have Gabriella Panza Beltrandi with Global.
Gabriella, are you there? We'll come back to Gabriella. And back to the room. Mark, do you have a question?
Yeah. Is the regulation changes what held up rapid testing and point-of-care testing being implemented sooner, or what was the delay from receiving the kits to getting it set up to be able to move into more different areas?
So with respect to the question and delay, just to remind, and you know this, Matt, is that the point-of-care testing is being rolled out, has been rolled out to over 150 long-term care facilities, as well as it's close to 100 areas in acute care. So it hasn't hasn't been a delay. We've been building that capacity across the province and testing in areas where we know we most risk outbreaks, as well as supporting those individuals that are at high risk. The next phase of the rollout, now certainly a lab license would have been a barrier, because if we have to wait for everybody to receive a lab license, it's a process that is not controlled by the SHA or the Ministry of Health. There's a process that's involved. And because the test is simple and safe, they've lifted that regulation, which allows us to get to other areas a lot quicker. It still does require some training and individuals to do it, and that's why we're the third-party RFQ going out to actually help those that don't have the assistance. But again, just to dispel some other rumors, there's a lot going around about the volume of tests and the risk of expiring, and there isn't a point-of-care test that's going to expire in the province of Saskatchewan. We'll have them used well in advance of that, and as Dr. Shahab has said, with the new variants, as well as a slower than what we want immunization strategy because of vaccine supply, this extra testing is going to go a long way to put a bigger safety blanket across many areas, including those essential services like police, fire, and ambulance providers.
Follow-up, Mark?
Yeah, the Saskatchewan Trucking Association is encouraging the government to have voluntary testing sites moved further away from the Canadian-U.S. border crossings and busy ports to avoid delay of the supply chain. Is the government considering these recommendations?
Yeah, thank you. So, I will take that back to discussion with the federal government, because obviously we have to recognize, like Scott said, that, essential workers have been working right from day one of the pandemic, and, people who work in the trucking industry have been one of those essential workers who have been traveling throughout Canada, throughout the U.S., at times when COVID activity is very high. So first of all, we need to acknowledge their role that they have played in keeping our supply, grocery stores, other essential products supplied. And obviously, they are exempt from some of the regulations that apply to travelers now coming to Canada by air or through the land border. But at the same time, I've heard two things from many individuals who are in this business, and one is that obviously they themselves want to stay safe for themselves, their own health, and for the health of their families. So they routinely obviously practice all the precautions that we all should be doing, and maybe at a higher level, and obviously seek regular testing. And irrespective of testing available at the border, regular testing is easily available in Saskatchewan. There's virtually no barriers to access regular testing. As point-of-care testing gets deployed, they can certainly use that more frequently. And then one thing I'll also want to flag is that many times people who work in the trucking industry have had challenges accessing not just healthcare but other personal care services, because there's a checklist that if you or your family has traveled. And I think all businesses that provide services and have that checklist, that's very important, should recognize that if someone is in an exempt service and they're regularly getting tested and they don't have COVID, they and their family should not be denied or delayed service, whether it's personal care or health care. So I think that's an important point as well. But absolutely, I think access to regular testing and whatever is more feasible for any industry, including trucking, will be an important consideration.
We'll take another question on the phone.
We have Stephanie Taylor with the Canadian Press.
Hi, Dr. Shahab, you say we need to be testing more now because of the variants of concern. How many tests should we be processing daily then?
Yeah, so I think there's two parts to this. One is, obviously, we've had targets in the past, 3,000, 4,000, 6,000. Some of those targets also have to be, realistic in terms of COVID activity. We always see that when COVID activity goes up, it's natural that people seek testing more frequently. We have our metrics, so the table I show with the 13 geographies, we have our metrics that we do want to see testing rates above a certain level, 120 per 100,000, for example. If it goes low, so in the south rural areas, our COVID rates are very low, test positivity is very low, but testing rates sometimes also start trending down, and that's not very good, because then you can start missing COVID, and we've already had situations where people were delaying testing even though they were symptomatic. So we absolutely want to keep our testing rates above a certain level, and what that exact number is, I think we can discuss that, but above 2,000 tests a day certainly is a good initial target. But then locally, if COVID activity is increasing, we would like to see a higher volume. And point-of-care testing, I think, makes it easier to seek that initial test. Obviously, if your test is positive, you still need confirmation. If your test is negative, and you're symptomatic, you still shouldn't then say, okay, I can do what I want. You still need to watch yourself, seek repeat testing, or do follow-up testing through the lab-based PCR. So that's an additional assurance testing that will open up testing for people who are also asymptomatic in a more easily accessible way, but also, but the existing pathway will be there for symptomatic. So I think, with variants of concern coming, and the fact that up to 40% of infections can be asymptomatic, even with variants of concern, testing will continue to be an important one layer. The more easily accessible it is can only be a good thing. But it's just one layer of all the other things we need to continue to practice.
Follow-up question, Steph?
Yes, Dr. Shahab, can you provide any insight on what's going on in the Regina area? Is there any evidence that one of these variants of concern could be driving what seems to be a rise in cases?
Yeah, so I actually have daily discussions with all medical health officers, but especially this morning, again, with the colleagues in Regina, both in the RRPL lab and public health, medical health officers. So I think right now, obviously, we have found variants of concern in 2 instances that were community acquired, not acquired through travel, so that's of concern. Whenever there's an outbreak, and that's been in place for several weeks now, whenever there's an outbreak, samples from that outbreak are always sent for whole genome sequencing, so that's happening right away with any outbreaks in Regina. And the rates that have been reported on the higher side, 80 today, and also some of that was adjustment from a lower number yesterday, but some of them have actually been generated by investigation of active outbreaks, especially in daycares. So as you know, whenever there's an outbreak, everyone who may have been exposed is tested, so that does increase the testing volumes, which is a good thing because then cases can isolate and the close contacts can go into quarantine, and that breaks the chain of transmission, so you don't see second or third generation. So that's driving some of the high case numbers. But absolutely, any outbreak in Saskatchewan, not just in Regina, will have a samples from those outbreaks sent for further analysis to see if they do variants of concern.
We'll take another question on the phone line.
We have Lisa Schick with CJME.
Hi. When it comes to the expansion of the rapid testing rollout, specifically and practically, how is this going to change things? Like, what does it mean for people? Are teachers going to be able to be back in the classroom sooner? Nurses back in hospitals?
So I can maybe provide some initial comments, and Scott, you can provide. I think, we are in a really important point of transition. On the one hand, thankfully, and I think there must be relief to colleagues in hospitals, our cases in hospitals and ICU are coming down. And I think we have to recognize that. We also have to recognize that although our cases are coming down, half of the cases are still infectious, meaning recently admitted. Half are not infectious, so sometimes hospitalization can take weeks for recovery to go home. So, hospitalization can result in a few days of hospitalization, many weeks. So that's one indicator we are watching, and it's trending in the right direction. Our overall case numbers are also trending, downwards. But within this, I think we have to recognize that, testing will allow additional reassurance, not just in individuals who are symptomatic, but individuals who, in various settings, workplaces, other settings, where, whether they are healthcare providers who have a higher exposure risk, or whether they are settings that are more prone to outbreaks, where testing will reassure staff about, if someone is COVID positive, and if someone is, they can quickly isolate, even if they were asymptomatic. So regular testing every week or bi-weekly will help in isolating staff. Because the challenge, of course, is that there's very limited supply of vaccine. Many of the workplaces that will take advantage of testing are essential workplaces. And unfortunately, we just don't have vaccine to give to them. So till such time we have our older residents vaccinated, and they become eligible, this will be a valuable tool to absolutely, like you said, decrease, exposures in the workplace and decrease the number of times that colleagues have to go on quarantine.
Yeah. So the only thing I would add is that, since July 14th of last year, Saskatchewan has had one of the broadest testing strategies in the country with respect to making testing available to anybody who wants it, regardless of symptoms. We built more testing capacity throughout last year and even today. And again, to Dr. Shahab's point, is if you don't make the virus visible, how do we contain and mitigate and delay its effects across our population? And we are at a point, with the vaccine, available to us, not in the quantities we want at this point in time, but providing that light at the tunnel, the additional testing, point of care testing, the dropping of the 48 hours of symptoms for PCR testing is all being put in place to make testing more available, to be able to jump on the variants or any other cases as quickly as possible to reduce the further impacts as we move through the immunization program.
Well, one thing I'll just add is that this additional testing may generate more cases, but that shouldn't be an issue. Yeah. And because we also look at who is getting infected, we've always seen that younger adults, 20 to 40, are most likely to test positive COVID. They're most likely to be working in public-facing jobs, and that we already know. So we may inflate cases in those age groups. We should be very concerned if people 16 and older are getting COVID, because we really want them to shield themselves, and we want everyone else to shield them until they get vaccinated. So, ongoing analyses of test positivity by age group and settings in which people get exposed is also going to be important.
Follow-up, Lisa?
There we go. Dr. Livingstone, you said earlier that there hasn't been a delay, I think, in sending out rapid tests, but I know a few weeks ago the Premier had said that they should have been sent out sooner. So I guess, why weren't they sent out sooner?
So the specific question was the lab licensing the barrier to rolling out testing, and it wasn't. It was the strategy was the barrier, and we were focusing on long-term care and acute care facilities, where we have some of the most vulnerable and where we've seen a large impact of outbreaks, both in long-term care and in acute care, where we've seen staff self-isolating for weeks at a time, reducing our capacity. So that was the context of my answer. So certainly with the change to the lab licensing, it allows us to move quicker into these more essential areas of the province and create that blanket of point-of-care testing that Dr. Shahab was just talking about.
We'll come back to the room. Adam, do you have a question?
Yeah, it's Scott. About a month ago, the SHA advertised a few community clinics for people over 70.
Yeah.
Has since stopped doing that, and there have been questions, at least to me, about why those communities were chosen, and also did it create inequality by offering the vaccine first and second doses to people over 70 before those over 80 and 90 around the province were vaccinated?
So it's a good question, and actually you spoke a little bit to a quote. I think you asked me for a question earlier this week in one of your articles, but just to remind folks, when we started the program, when we had a new vaccine that was ultra-frozen, and we didn't know all the restrictions on us on how we could move it and get it into to communities so that we could vaccinate. When we did do the first rollout of vaccine, and when we did get to long-term care and home care and had vaccine left over, and we're worried, of course, about how stable the vaccine is in the thawed state. We've learned a lot about that now and how long we have to actually use that, more than we did at that time. So that when we had those clinics and had available vaccine, after we went through long-term care or the targeted areas, there were public service announcements in those communities opening it up to that 70-plus population. And we've learned, just like we're learning right now, that having people contact, having us contact people isn't the best way to efficiently deliver vaccine. As what you're going to see in the upcoming days is us do an about face, where people are going to be able to book their own appointments, choose where they're going to get their vaccine in clinics that have available vaccines. So certainly there were differences. I would point out, up until recently, the entire community of Swift Current had nobody vaccinated. Some of the highest priority, high-risk individuals, long-term care and personal care homes, were sitting down in the southwest of the province unvaccinated. That wasn't because it was an intended consequence, but rather, one, vaccine supply, and two, we were moving into higher priority areas simply because of the prevalence of the disease.
Going forward, how are you deciding where the vaccine's sent? because I know, there's going to be different numbers, as you say, but people are going to want to know, if I'm in Regina, I'm 80 years old, when can I expect the vaccine, regardless of whether the supply is there?
It's a great question, and Derek is on the line with us, so he can probably expand as I give you my first comments on that answer. So as you know, within, hopefully by Sunday, will be complete long-term care and personal care home vaccinations across the province. And that means that we'll be moving to the next priority, which is our 70 pluses. How we're going to do that will be 100% dependent with respect to how we offer clinics across the province based on available vaccine supply. But as we talked about, the biggest determining factor is age, so we'll start in the highest age group and start offering clinics that we can supply vaccine to and move through it in that way. In the upcoming days, you're going to see an online booking system as well as a telephone line booking system so that those residents can book their own appointments instead of us contacting them. We've been using, as you know, lists that have been generating through vital statistics and health card registration, and the one thing we found out is those lists aren't complete, and that's, some of the angst we're seeing and the expectations in the community. We're not going to miss people. We will make sure that we don't, and once you are qualified, you qualify for vaccination throughout the entire time frame, including phase 2. But I'll just ask Derek to expand just a little bit on some of the things that we're doing to ensure that the distribution of vaccine is as equitable as possible. But again, just to highlight, one of the single biggest challenges to implementing the program and making sure that we can go in a coordinated, transparent, and fair way is the availability of vaccine. Derek, do you have anything to add?
Scott, thank you. The only thing I would note is that we did see reductions over the last number of weeks through February in the anticipated supply, so we would have been better positioned to get through long-term care and personal care homes, those high-risk groups, faster, and be moving into the over 70 sooner. But we are limited in vaccine supply, and that's a big learning curve for us. That is really driving our ability to proceed on the campaign. We want to go as quickly as possible. As we go forward in terms of providing that access to individuals, we want to provide a fast and easy way for residents that are eligible to book into the system and to access their vaccine, and also to do it in an open and fair and transparent way that people can easily understand. So as Scott spoke about the list that we are using right now to contact individuals, we are proceeding through that list, descending by age, so obviously going for our oldest populations first, that they're the most at risk. And then we are looking forward to, over the next few weeks, when we're able to go live with our online booking system and the 811 vaccine call center to allow the public to start booking into that system. We will be opening up access by age to the booking system and controlling that and aligning it with the known vaccine supplies. We're hopeful that as we get into March, we'll learn more about the vaccine supplies for the next 3 months, going into April and beyond, that will really allow us to solidify the clinics that are going to be open, the capacity on a daily basis that they'll have, and get those set up, and then also to align the booking system to that capacity, and then start opening it up to the population by age. So it is a bit of a complex process, and we appreciate the frustration. And as Scott said, people aren't missing their opportunity. The opportunity will be there. We're just very limited with the vaccine supply as it is right now in the moment.
We'll take another question on the phone lines.
We have Laura Fominov with CKOM.
Hi, this question is for Mr. Livingstone. Mr. Livingstone, I'm really, really confused because just now you were mentioning that there's going to be an online booking system, that there will be an 811 call center coming up in the coming days and weeks. But just yesterday, we received information, a statement, in fact, from the health minister indicating that for people who were wondering about how, when, where to potentially get vaccines for those who are over 70 years of age, that the health authorities would be contacting people, essentially saying, you know, we're creating these lists through eHealth and through vital statistics and so forth. Don't call us, we'll call you. And now I'm hearing something that's completely the opposite. So how do you explain that? And can you understand how people might be very confused right now?
So I'm just trying to figure out what the actual question was, but I think I know what you've asked. So if I haven't answered your question at the end of what I'm about to say, just ask it again. But so as we've moved through this phase 1 of the vaccination program, the single biggest factor which has determined how we've offered vaccine, where we've offered vaccine, is not just the definition of priority groups, but is the availability of vaccine. And as you've heard probably at least 50 times today in this news conference, the availability of vaccine, which has been changing on a weekly basis, has made the teams pivot a number of times. So as we've been moving through phase 1, we have been focusing on the most high-risk individuals, long-term care, personal care homes, the staff that work within them, and a priority group of healthcare workers that are critical to the operations of the system. So as we get those folks done, and we're almost there, even given the short supply of vaccine, we have been opening it up to 70 plus, and the decision was made because of, to Adam's comment earlier around the opening it up to a public service announcement and having this wild frenzy for individuals who are not getting the information because they're either not checking or not getting it. A decision was made in the early phases of the vaccine program with the limited supplies to actually start contacting individuals and booking them into the clinics, and that's what we've been doing. However, what we're finding is the lists that are being used is raising concerns for a number of individuals because they either haven't received a call when a vaccination program starts up in their community of 70 plus. And as we have been building capacity for the vaccine program for phase 2, which includes mass vaccination clinics, over 220 plus sites across the province, that's where our call-in line and the scheduling system was going to be primarily used. But we've made a decision, actually this week, to use the system earlier so that we can reduce some of the anxiety in the 70 plus group because they can make sure that they can book their own appointments online or through the telephone through us. And in fact, right now, even though we're calling individuals in 70, we're demoing the scheduling system. So that we're actually calling individuals, but we're using the scheduling system to see how it works, preparing ourselves for the mass vaccination, and we are expanding it now to 70 plus. So I think that hopefully will answer your question, but explain the difference, but if I haven't done that, please tell me.
Lara, do you have another question?
Yes, I do. Thank you very much. Thank you very much, Mr. Livingstone. The other question I had for you was, what specific plans does a health authority have in place when there are extra vaccine doses? By that, there have been, as far as we're aware, several instances so far where there have been extra doses when priority healthcare groups are finished, the ones who are booked are finished for the day or what have you, and there are doses left over. What specific plans does the health authority have to get those extra doses into the arms of the people who need them?
Yeah, that's a really, really good question, and I'm going to pass that one over to Derek because he will be able to tell you what the direction to the teams have been given so that if there are extra doses, and as you've said, there have been, so he'll go through the process of what we've directed teams across the province to be able to do that in a standardized, fair, and transparent way. So go ahead, Derek.
Thanks, Scott. So we have established a work standard, which is a process to help local teams manage cases where, after going through right now going through long-term care, personal care homes, or for clinic operations for booked appointments, that if there are doses available at the end of the day or at the end of the session, that they would have a number of individuals identified that fit within the eligibility grouping that would be on standby, that could be called in to receive those any extra doses that might be available. So that's the process that's been put in place, and it's required by the teams to have that set up as they're working through their appointment.
I think we're good. Okay, we'll circle back to see if Gabriella was able to connect.
Can you hear me all right?
Are you there?
Yeah, we can hear you.
Perfect. All right. I just have a question. So when people, you said in the coming days, can start contacting, whether online or through the phone number, about booking their vaccines. We've seen in places like Alberta where people who have been trying to book vaccinations, they have had website crashes and stuff like that. Is there anything in place to make sure that we don't have crashes and that people won't be cut off when they are trying to book appointments?
So, and a good question, and we all watched and with horror on what happened to Alberta yesterday, and certainly the team is doing a number of things to mitigate any risks associated with volumes that exceed the capability on both the phone line and the online booking system. And one of the things that we've been doing is trialing, as I said, working through some of the kinks on the online booking system by using it now to book appointments. The other thing that will happen is as we, so to keep in mind, as because of the limited supply of vaccine, there will be specific age groups identified for eligibility, even within that 70 plus. So we won't start just unless something miraculous happens with vaccine supply in the next couple of weeks. When we open up the online booking system, we'll be identifying specific age groups that are eligible to book appointments and phone-in appointments, and it will not be all of 70 plus. So one of the reasons that is happening, as I pointed out, is vaccine supply. But the other thing is that it allows us to use there'll be a smaller number of individuals calling in to book, because we'll be using these tranches. And it's not, we're going to identify the 80 plus and say, for the next 2 weeks, this is who goes in. It's really open up the system. For the first 2 to 3 days, the 80 pluses are booking, and then we actually expand as vaccine becomes available to us. Derek, did you have anything to add?
I'll just say that, the Alberta experience really provides a bit of insight into some of the key risks of an endeavor like this. We're working hard on across the board to make sure that when we launch our phase 2 and when we launch our the booking system in the coming weeks, that we're ready and that we're going to provide the best possible service to Saskatchewan residents. And learning from other jurisdictions has been part of our strategy all along. So that's all I have to say, Scott. Thanks.
Gabriella, do you have a follow-up question?
Yeah, just following up, this is a completely different question, more about the rapid testing. Talked about places getting certified to be able to distribute these. I guess how long will it take them to be certified? I guess how does that process work, and how long will that take?
So it won't be the same for all areas, as I said before, and I use the example of schools where there are resources available in a school. It would be a faster process. It's not hard to train an individual to actually use the point of care test. To be honest, the bigger issue is to make sure that the reporting of the results is done centrally, and we actually, as we're opening this to non-healthcare facilities and non-healthcare providers, what's important is that those results flow so that we actually can follow up and identify positives as quickly as possible. So the training for the test, a point of care test, doesn't take long. Derek might be able to give you a better idea of how long it's taken us to train somebody, but it's the logistics around being able to provide the data to us so that we can follow up on the testing and identify the individuals that are receiving the test, and then follow up if there is a positive with the standard PCR test. The other thing to keep in mind, as I said, because we know some of these organizations, businesses, essential care workers and areas may need support to be able to administer the point of care testing in their particular area of business. That's why that RFQ is out on the market. It will be providing a third-party support to those organizations. And that's going to take a little bit of time, so it'll be a few weeks for sure. But again, it will be a sequential rollout based on the readiness assessment of those particular organizations and businesses, as well as ensuring that we put a process in place so that the data can come back, so that the testing is actually being useful as that safety blanket.
Let's come back to the room if there's one or two more. Adam?
On the outbreaks in Regina recently, can you tell us any more about numbers? Are they concerning? Are there going to be PSAs put out, that sort of thing, to identify people You mentioned there's a daycare that's seeing a rise in cases because of the investigation. What more can you tell us about these outbreaks?
What I'm aware of is that there's one and possibly more daycares at the moment, and then occasional workplaces. But because everyone is accounted for, if you know everyone who's been exposed, there's no need for a PSA. But obviously, there's quickly everyone is offered testing, and that generates additional cases. But then that's exactly how then in some cases the daycare may have to close for a few days. Obviously cases and close contacts isolate. And then the business operations start. So I think we've seen those in the past. We'll continue to see those in the future. The only additional, I think, couple of things we need to keep in mind is that all outbreaks now will have samples sent for testing for variants of concern, and I think this again is telling us that even though our case numbers are coming down, we can't go back to where we were with the same case numbers, like in late summer, early fall. We have to be extra vigilant for variants. But on the other hand, we are obviously very optimistic that our vaccination programs are. So I think it's a new phase for us, more testing, more vigilance around variants of concern, but also optimism around vaccination. And of course, that's linked to, patients for age cohorts as they become eligible, and the need for us, especially if you're 50 and older, to continue to shield yourself really well. I mean, we're all tired of COVID. This is our 12th, 13th month of the pandemic. But generally we've all done well to keep our case numbers low. We've had our first true wave in the fall. People are talking about the third wave, due to variants of concern. We have to do everything we can to make sure that especially those who are most vulnerable, stay safe till they get vaccinated. And all of us, keep each other safe through all our public health measures, and also where required testing, which again is generally available, but also now would be targeted in settings where we had more outbreaks, because you have to work in close quarters with each other or with the clients. So I think that's the setting where the point of care testing will be an additional tool that can be deployed.
Mark?
Just looking for clarification on the website and phone number. When is that expected to go live? And when's that expected?
So I can't give you the exact date, but it's going to be, it won't be next week, but it's probably going to be early the week after that. So within the next 10 days.
Sure. Jumping back to variants of concern too, it kind of seems to be this, I guess, bit of a race between getting everyone vaccinated before these spread dramatically, basically. Do you feel like that's a race we can reasonably win, or with the rate of vaccine delivery right now, do you think that's kind of a lost cause?
Well, I think, I won't say lost cause, but you're absolutely right. There's a couple of things that we need to be aware of. One is, it is a race against time. We have variants of concern, but we've also seen in Israel and the UK that they actually had a situation where they had the third wave in full swing due to variants of concern. That's when they launched their vaccine program. Good, steady supply of vaccine, and in 2 to 3 months they have shown a dramatic decrease in hospitalization, deaths, and now overall cases, especially in ages 60 and over who have taken up the vaccine, and now they're moving into the phase of younger adults, encouraging them to take the vaccine. But they have seen, even though the variants of concern are circulating, they've seen a dramatic decline. So for us, obviously the hope is that we can continue over the next weeks or months to start vaccinating with a high uptake in people who are older, 70 and older, 60 and older, 50 and older, then as vaccine supplies allow, essential services, and then over the late spring, early summer, the general population, and continue to have that high uptake even in younger adults who hopefully by the summer, if case numbers are low, we may not think about that much about COVID, but we should still all consider getting vaccinated when it's available. And then what that allow us is that allow us to end the pandemic, because the pandemic is a situation where you have severe stress on the healthcare system. And even though we were lucky in the spring not to have had large outbreaks in long-term care or a high level of hospitalizations, we unfortunately did see that in December and January. We saw devastating outbreaks in long-term care. Hopefully that danger is now passing. We saw tremendous pressure in acute care and ICU. That's declining. But we have to be realistic. We can't predict the future 6 months, 9 months out. what I can say is that the best thing we can hope for is a high vaccine uptake that takes the sharp edge of the pandemic away. Then in future, how endemic will COVID be? Who will it impact more? How will it impact people who've been vaccinated 6 months, 8 months out? Will people at higher risk need a booster shot like people do for the flu vaccine? Those are important questions for the future, for the fall. But I think right now our focus has to be make sure, over the next few weeks, 2 months, spring, early summer, people at high risk get vaccinated. Until such time, we keep our case numbers as low as we can, doing everything we've been doing so successfully. We have not been in lockdown, but despite not having to go in lockdown, we have seen our case numbers coming down. And now with vaccine uptake in long-term care, personal care home, we hope to see, less instances of those outbreaks in those settings, and then over time, less incidence of COVID in the elderly, where the hospitalization rate and mortality rate is high. But then, at least that way we would have overcome the pandemic, but we still may have issues with COVID as, a viral illness that will most likely become endemic, at least for the next few months or years. But we will be out of the pandemic, and then we can obviously start seeing, hopefully by summer, relaxing some of these restrictions that we all have had to live with now for 12, 13 months.
Thank you, everyone, for taking the time to join us. That concludes today's availability.